formally endorse Russ Feingold for re-election. Russ has earned our endorsement because he's always been a champion of the concerns of Wisconsin retirees and seniors. This is especially important today in light of the movement to privatize Social Security. His opponent, Ron Johnson, has claimed Social Security is a Ponzi scheme and supports plans to privatize it in the future. During his campaign and in the first debate, Johnson illustrated how little he knows about Social Security when he claimed the baby boomers would bankrupt the program. He seems to not know that the baby boomers were all born in 1983 when the Greenspan Commission developed the program adjustments to ensure Social Security would be there for them. Johnson also said there was no money left in Social Security. He's totally unaware of the $2.5 trillion of bonds in the trust fund, a total that will reach $4.5 trillion by 2020. These are treasury bonds, similar to the $3.1 trillion held by the Chinese, or the $36 billion in treasuries that were sold last Tuesday at the auction. Senator Feingold has worked to bring fiscal responsibility and control spending since his first day in the Senate. He knows Social Security has not added 1 cent to the national deficit, and that Congress should not use the deficit as an excuse to cut Social Security benefits or extend the retirement age. Russ has fought to make prescription drugs more affordable for retirees and seniors through the extension of the Wisconsin Senior Care Program and through the passage of Medicare reform legislation. Russ Feingold recognizes the contributions of Wisconsin seniors and is dedicated to ensuring that Social Security and Medicare not only continue, but are kept strong and adequately funded. From knowledge gained through his annual listening sessions in every county in the state, Russ has an awareness of the challenges retirees face as they deal with daily issues of health and finance. Now I'm pleased to ask Vivian DeBack to introduce Senator Russ Feingold. All right. Vivian is a registered nurse, has been a professor at 2 nursing universities, and has worked on international nursing issues. Vivian?
Thank you.
All right.
I think all of you remember, as I did, Russ's first campaign, where he had a wonderful ad campaign on the door of his garage. On that garage, I indicated all the things that he would do for us over the years as he would be senator. And Russ has kept that promise. He has visited, as Leon said, the 72 counties of Wisconsin every year with listening sessions, so that people of Wisconsin can not only meet and talk to a senator, but can do so without having to make an appointment, not having to give a political contribution, and not having to travel to Washington, D.C. He has always been there for us. He's been there not only to protect Social Security and Medicare, but to make sure it is not privatized. And he voted for the health care bill. That health care bill will continue to unfold for the next few years. And we as seniors will understand all of the things that are there on our behalf to keep us healthy, to keep us strong, to keep us part of the community. I'm telling you, we need this man back in the Senate.
Yes, we do.
It's up to you and me. Not just to vote. I expect all of you to do that. And you can do it early if you want. But it's more important that you get others to go with you. My grandchildren are being told who to vote for. It's up to you. It's up to you to take seniors to the polls. Other people who might not have gone there or forgot or forget on November 2nd, please get the vote out for Russ Feingold. I am so proud to introduce Senator Russ.
Vivian, thank you so much for kind words. And this group, the Wisconsin Alliance for Retired Americans, has always been at the forefront of senior issues. It's why I am so honored to accept your endorsement today. I'm thrilled with it, and I'm grateful to have this kind of support at this critical time in the campaign. Together, we will fight hard to protect seniors and safeguard the necessary reforms of the health insurance legislation that Vivian just mentioned. It actually strengthens Medicare without cutting a single guaranteed benefit. And improves. The opponent put out a hit document to every senior in the state trying to suggest that somehow it did just the opposite. It's completely false. The health care bill actually improves benefits for more than 870,000 seniors. And as you know, the health care reform bill closes the Medicare Part D donut hole. How many times have I heard about this donut hole? Which starting this year will act already helping reduce out-of-pocket costs for seniors. And the bill guarantees first dollar coverage for preventative and wellness care. I was also a co-sponsor of the bipartisan Pharmaceutical Market Access and Drug Safety Act. And that would allow the reimportation of safe FDA-approved drugs from Canada, a bill that would help seniors stretch their dollars. Well, right now they're trying so hard to make ends meet. Also introduced a bill to allow the federal government to negotiate prescription drug prices offered under Medicare. And I'll continue to fight every time any privatization or any other proposals that would put Social Security at risk, and that is where there is a clean and clear difference between me and Mr. Johnson. Now, protecting Medicare is one of the most important issues today for seniors. Medicare is a lifeline for seniors to get the care they need, even more during these tough times. And the last thing we should do is to cut Medicare benefits. But this is exactly what Mr. Johnson supports. I'm here today because Mr. Johnson has made it clear that his first priority is to repeal the measures that protect Medicare for seniors, reduce out-of-pocket costs, and strengthen the financial stability of Medicare without cutting a single guaranteed Medicare benefit. He supports cutting Medicare benefits for Wisconsin seniors. By repealing health care reform, he's just plain going to take away those rebate checks that people are starting to get for paid prescription drugs. He's just going to take them all away. Mr. Johnson will open up the prescription drug donut hole, increasing out-of-pocket costs for Wisconsin seniors. And here's another one that I think they're all aware of here, especially in Wisconsin. He would return to an unfair Medicare reimbursement formula that has penalized Wisconsin medical providers that are focused on high quality rather than high cost care. He opposes rewarding providers based on the quality of care they provide patients. And we've worked on this so hard for years and years, and we got it done in the health care bill. He wants to just take it away. That's just ridiculous. Ron Johnson says we need to look at what he calls common sense plans that would abolish Medicare in its current form for everyone currently below the age of 55. I'm over that line now. But I sure care about everybody that's under it. I don't want to see their Medicare benefits cut. I think that's wrong. Ron Johnson has praised a plan that would increase the financial risk for seniors by putting them at the mercy of private insurance companies without any protection. Finally, this summer we celebrated the 75th anniversary of Social Security, a great Wisconsin idea. It was born during difficult times. No single program has done more for seniors than Social Security. Yet some still want to put Social Security in jeopardy by privatizing the program, by handing it over to Wall Street, the big banks that triggered the economic crisis from which we're still trying to recover. As was said by Leon, Ron Johnson has said on multiple occasions, he loves saying that Social Security is a Ponzi scheme. And he even compared it to Bernie Madoff. Ron Johnson believes Social Security is an unsustainable entitlement and says all options should be on the table, and has praised plans that would raise the retirement age and privatize parts of Social Security. Now look, he's trying to pull over the eyes on this one. He said, "Oh, you know, all you seniors out there are already over 65. I'm going to take care of it."
Yeah, right.
He says, "We're not going to touch your benefits. But if you're under 65, he says, everything's on the table." Well, he doesn't know about the people I'm standing with. They don't just care about themselves.
No.
They care about their children. They care about their grandchildren. They care about promises that were made to them, not just about themselves. And in fact, I would say they care more about those family members and others who are counting on having Social Security not be privatized. That is the clear difference between us, and it is the biggest difference you can imagine.